Welcome to this edition of the First Aid Show. A breathing problem could be caused by a number of things. In this film, we asked a paramedic about identifying and managing a patient with a breathing problem.
So if somebody's in distress and they say they are struggling to breathe, there are several things that you want to try and understand about the situation that can help you to decide and treat them in the right way. One, you're going to stay calm and reassuring for them because you want to lower any anxiety. If they are breathing fast, you need to talk to them and encourage them to slow down their breathing rate. Because if they breathe really fast, they might start to experience pins and needles in their fingers and in their lips and in their extremities, which is very unpleasant and just increases the stress of the situation. If you notice that their mouth is changing colour and their ears and their face or their fingers, again, this is important detail to tell the person that's taking the 999 call. It's not our job, if you're not medically trained, to try and diagnose what their breathing condition is. It's just your job to make sure they are reassured, that telling them that you're with them and they are safe, and you're optimising their position to help them breathe. Sometimes the cold air can make it worse. And sometimes it might be a reaction to something that they're allergic to. So if that's the case, take away the thing that's causing that reaction, and you might close the windows or make sure they're not outside in the cold, because that can make it harder to breathe.